Good afternoon, Dr. Baker with the Conde Center. Today's condition is Thoracic Outlet Syndrome. The reason I bring this to attention is because we see it misdiagnosed so often. A lot of the times cervical, neck-related complaints that we get, there's numbness and tingling down the arms, and that's something that Thoracic Outlet Syndrome can do. But the cause is completely different. So getting into the TOS, this is where it's located, thoracic outlet. There's certain muscles, the scalene muscles, that are responsible for causing that numbness and tingling down the arms. And when these muscles get tight, compressed, they're overutilized, it can start to irritate the nerves or the vasculature, the blood vessels that exit that region and go down the upper extremity. So numbness and tingling, most common. We work through decompression therapies on discs and stenosis, degenerative changes in the neck all the time. And if people aren't responding properly, it's the most common way that you can help with nerve compression. But that's with thoracic outlet, it's totally different. So these deep muscles, you need more manual therapy techniques. You need a release to the soft tissue, and you need to change breathing patterns. The thoracic outlet, it tends to be irritated by upper respiratory breathing. So chest breathing. Okay, lifting the rib cage up. It's not the design of the body for our normal breathing pattern. You're supposed to breathe with your stomach and your diaphragm. It's a more relaxing parasympathetic breathing pattern. Breathing with your chest is something that we changed at some point in our life. Babies breathe naturally with their stomach. When you breathe with your chest, you're under breathing, you're lifting the rib cage, you're only getting a shallow breath. But more importantly is it's overutilizing the small muscles that lift the upper ribs that attach to the neck. And if you're using those muscles too much and they're not designed for it, they're going to get tight, they're going to compress the structures in that outlet, and then eventually cut off some blood flow or irritate the nerves, compress some of the nerves. You will get symptoms of numbness and tingling and or pain and weakness in the arms. So it's something to look out for. Manual therapy techniques are great for it. There's specific releases that chiropractors are great at doing for that region. A stretch to help release as well would be extending the arm, tilting the head up and away. This is a test that chiropractors do that's known as the Adson's test. There's a stretch that will help with it, okay? But you don't want to overdo it. So always get things evaluated first. Just know that if you had that symptom for a while, it's not going away. Maybe you're sitting in a car and you're putting your arm behind the other headrest, and then eventually it's going numb or tingling or pain. That can be a sign of the thoracic outlet being compressed to those nerves and arteries. So evaluate things, try some stretching, change your breathing pattern. Don't overutilize the rib cage in the ribs as well as it connect with the clavicles. Breathe with the diaphragm. And if there's anything else, always check for more.